This video was made for the Mount Sinai Hospital Emergency Department staff and is intended to demonstrate the correct technique for getting into and out of the personal protective equipment required for healthcare workers to safely care for patients with suspected or confirmed Ebola virus infection. The information contained in this video is current as of October the 16th, 2014. A key concept in this video is understanding the line marking the clean and contaminated areas of the anteroom immediately outside of the isolation room. In this video, the healthcare worker will be doffing their PPE on the contaminated or left side of the line until the final stage when their shoe covers are removed. Care must be taken to ensure that the clean side of the anteroom is not contaminated. Additionally, the donning and doffing of all personal protective equipment is to be performed in the presence of a buddy to ensure that all steps are performed in the correct sequence. When exiting the isolation room, have your buddy stand on the clean side of the line with the checklist to ensure that you safely remove your PPE in the correct sequence. Step 1. Remove outer gloves. Take hold by pinching the material just below the cuff. Avoid sticking contaminated fingers inside the gloves and dispose of these in the biohazard bin in the isolation room. Step 2. Once you exit the isolation room, untie the side of the gown and pull apart the seam where it was taped closed. Step 3. Remove gown and inner gloves together. Cross your arms, grab the gown, and pull it apart from the front. Make sure the gloves and gown come off as one unit. Roll the gown inside out, being careful not to touch the contaminated side, and place in the biohazard bin. Step 4. Perform hand hygiene remaining inside the contamination area line. Step 5. Have your partner pass you some clean gloves and put these on now. Step 6. Remove head coverings into the biohazard bin. Bending forward over the bin, remove the plastic head cap. Lift the face shield from behind, up and away from your body, keeping hands clear of your face. Untie the hood, and using one hand to pinch the bottom and the other to lift from the top, carefully pull the hood up and away from your head and place it in the bin. Step 7. Remove gloves into the biohazard waste bin. Step 8. Perform hand hygiene. Step 9. Have your buddy pass you a new regular face shield and clean gloves from the clean side of the anteroom. Do not step out of the contaminated side. Step 10. Remove shoe covers. Sitting on a stool on the dirty side of the contamination line, start with the leg closest to the line. Reach under the lip you created when donning the shoe cover and pull or roll the cover down, inside out, to the heel and over the foot, being careful not to touch your own clothing. After removing the cover, place your foot onto the clean side of the line. Discard the cover in the biohazard bin and repeat the procedure with the other leg. Step 11. Remove gloves to the biohazard bin. Do not stick contaminated fingers inside the gloves. Step 12. Perform hand hygiene. Step 13. Remove the face shield by lifting up and away using the elastic at the back. Place in the biohazard waste. Step 14. Without touching the N95 respirator, remove it, starting with the bottom strap. Place it in the biohazard bin. Step 15. Perform hand hygiene.